Well, as mentioned, a Leon County judge last week ruled that Governor DeSantis' blanket ban on mask mandates in schools violates the Parents' Bill of Rights law, which allows school boards to infringe on the rights of parents if the board policy is narrowly tailored and serves a compelling state interest. The governor's office has filed an appeal. St. Petersburg Dr. Mona Mangat is an allergist and pediatric specialist and testified in the case in favor of keeping mask mandates in place. And she joins us now. And Doctor, welcome to Florida this week.
Thanks for having me, Rob.
I want to ask you about the governor who says that there is no scientific evidence or medical consensus that universal school masking prevents the spread of COVID-19 among children. What do you say to that?
Well, I say what I said when I testified, that that's patently false. It's a false statement. And we have data that we presented that shows that masking is definitely effective. I specifically spoke about during the trial a case, a study that was done where there was particulate matter sent from one person, we'll call it the source, to the target. And the study was to see whether masking made a difference on how much particulate matter reached the other side. And wearing masking, independent of what kind of mask it was or how far apart you were, it prevented the transmission of those particles by 99%. And this is not just one study. There have been multiple studies that show that. And unfortunately, the governor's office really chose to cherry pick some data. And it's data that even the authors of those articles in their discussions recommended that universal masking was clearly effective.
And even the judge agreed with you when it came to the science. What are you saying?
Yeah, science. It wasn't an opinion. You know, this was science. This was data, and that's, I think, where why we prevailed in this lawsuit.
What are you seeing in your practice? A lot of people say kids, if they get it, COVID isn't that dangerous to them. What are you seeing in your practice when it comes to kids?
Yeah, so I take care of children and adults that have chronic lung diseases as well as immunodeficient patients. And I'm seeing a lot more COVID in children as compared to even, 3 months ago. Last year, it was a rare occurrence for me to see a child with COVID, and now I'm definitely seeing more. I'm seeing more multi-exposures in the household. So before, if we had one person with COVID, sometimes it was just that one person. Now we're seeing a child and a parent. And so that becomes a little bit more problematic. And I don't care for patients in the hospital. And so my exposure is primarily outpatient with these children, but my colleagues are overwhelmed in the hospital. Our local hospital, All Children's, is full of pediatric patients that have COVID, which is something we were not seeing even 2 or 3 months ago.
So what's the best advice that you give to parents and children that you see in your office about mitigating the risk of COVID? What do you tell them when they come into your office and they're concerned now that school has restarted? How do you prevent the spread when you go to school besides masks, or what do you tell them?
Yeah, well, I think it's really important to think about prevention as a multi-layered or process. And so there's nothing that gives us 100% protection, but there are combinations of things that we can do to make children safer. So obviously, if your child is 12 years of age or older than that, they should receive a COVID vaccine. And whether they're COVID vaccinated or not, they should be masking when they're in school. Masking helps protect you as the wearer, as well as the person that's across from you, who may or may not be vaccinated. And I think it's important that families sort of model that behavior and talk to their children about they're not just protecting themselves, but they're trying to help protect their classmates or their teacher or their classmates' families, things like that. And I think also trying to talk about good hygiene at school, and sometimes with younger children that's more difficult, but talking about good hand washing and making sure that we are using hand sanitizer when possible. I think social distancing is something we should also discuss with our children, and we should practice what we preach. So, this is the time to think about my kid's having a birthday party. Do we want to have 20 kids inside at laser tag, or do we want to do a pool party outside with 10 kids? So just trying to make smarter choices, understanding that we're trying to mitigate risk with multiple different approaches.
Well, Dr. Mangat, thanks a lot. It's great to see you again. Thanks for coming on the program.
Good to see you. Thanks, Rob.
With so many Afghan refugees needing a place to resettle now that the U.S. military has left the country, we'll find out how many of those refugees are heading for Central Florida in a moment.